Hello, thank you for allowing me to talk to you in this format about what we do here at Winsong Radiology Group that could potentially be of service to you. My name is Ian Wilson. I'm an interventional radiologist and a graduate of the University of Rochester School of Medicine. I completed my training in interventional radiology in 2006 and was faculty from the University of Rochester from 2007 to 2016. At present, I am an interventional radiologist at Winsong Radiology Group in Williamsville, New York, where we have rather advanced imaging capabilities which often rival that which you can find in hospitals. One of the conditions that we've been asked to treat very recently by our orthopedic surgery colleagues is for persistent pain in people that have had knee replacements. Here we have an MRI which shows some abnormal inflammation of the joints, and how we perform a procedure that can address that is by first doing an angiogram, which is injection of contrast dye into the arteries, and using our imaging system, we can acquire a three-dimensional rotational angiogram, which allows us to build a three-dimensional roadmap of the blood vessels that supply blood to the knee joint. And it's that inflammation, that increased blood flow that causes the persistent pain after a knee joint replacement in a small percentage of cases. What that three-dimensional roadmap allows us to do is to access these very tiny vessels using very thin catheters and guide wires. And what that access to these vessels allows us to do subsequently is to inject particles which block the blood vessels that supply blood to the abnormal joint capsule, okay? One of the things that the imaging capabilities do is allows us to image around a knee prosthesis. Things like that would be ordinarily a barrier to seeing blood vessels, but however, using our techniques, we can actually subtract that hardware out of the picture and allow us to better visualize the blood vessels so it can be as selective and accurate as possible. One of the things that I often do is I ask patients to tell me exactly where it hurts. If they can put one finger on where it hurts the most, that usually is the area that shows up as being hyperemic or demonstrating increased blood flow on an angiogram. In this case, this patient had some pain on the outer aspect of his knee, which you see as a blush of contrast on the angiogram there. That vessel was injected with particles, which ultimately allowed that hyperemia to be diminished and for the patient to have improved quality of life because of decreased joint pain.